Hi everybody, it is Wednesday, it is noon, and this is Moments in Medicine Live here on the Nebraska Medicine Facebook page. My name is Kayla Thomas, and today I'm talking about a topic that has been very popular in the news lately, and that is chronic pain and pain management. I'm joined today by physical therapist Dr. Joe Siracusano. Thank you for being here today.
My pleasure.
And clinical psychologist Kim Vasek, right?
Yes, Dr. Kim Vasek.
Dr. Kim Vasek. Thank you, doctors, both of you, for being here today. We've got some great questions on our chronic pain management program we'll launch into in just a second. But first, a reminder, the information in this live chat is for informational purposes only. If you have any questions specific to your health or your medical condition, direct those towards your doctor or towards any medical professional. And of course, if you have topics related to our discussion, that's one of the reasons why we're here. We're giving you access to these experts today. Go ahead and post those in the comments, and we'll get to as many of them as we can live during the discussion. And if we don't get to those live today, we'll follow up with you and post those responses on Facebook in as timely of a manner as we can. So all that said, chronic pain. Let's start with you, Dr. Siracusano. What kinds of pain are we talking about, and what parts of the body are affected?
The type of pain we're talking about has to do with pain that a person has experienced. Traditionally, it's thought to be longer than 6 months. Mm-hmm. That's enough time for healing to occur. And if the person continues to experience pain, then the physician may wish to do more diagnostics, but eventually a person comes to the point where they're having to rely on things simply to reduce the symptom of the pain. For persons who have done that long enough, there are plenty of interventions to help a person with that, and hopefully that would suffice. But when a person has to continually return for medical interventions to manage their pain, this is the time for a person to consider treatment in a chronic pain management program like the one we have here at Nebraska Medicine. And this can be the case whether or not the person has an active change in their body, either physiologically or structurally. But essentially they're medically stable. And the nervous system has had enough time to change around the pain. And that is what makes the chronic pain stay, is not so much healing has not occurred, but rather the change that the brain made during the healing process to try to protect the person is still going on, very much like a stuck horn on in the middle of the night. It says warning, mm-hmm. but you go out and it's nothing wrong, it's just that the horn is still on.
Dr. Vasek, how common is this? How many people are affected by chronic pain?
It's a great question. It's a common question. According to the most recent CDC estimates, we think that in the U.S. about 50 million Americans have chronic pain, but I've seen those numbers upwards of 100 million as well. But what we do think is that about 20 million of those folks in the U.S. have what we consider high impact chronic pain, which means pain that has begun to interfere with their daily and work activities. So what research has shown is that for those folks who are having restrictions in work and life because of their pain, that is associated with higher degrees of, or higher percentages of opioid use, higher incidence of depression, anxiety, poorer quality of life. So those are some of the things that we're also trying to target, prevent where we can, and remediate where we can't.
I want to not gloss over something that you just said, and that's that reliance on opioids, because it's a huge issue. It's in the news this week, and there are a lot of people who are relying on drugs that they don't want to rely on. How can a program like this help with that? And what's the problem with being so reliant on those drugs?
Well, they don't work. They don't.
That's a problem.
That's the basic problem. Those kinds of medications work beautifully after surgery or an acute injury while the body is healing. Like Dr. Siracusano said, with chronic pain, the type of pain that we deal with, the body already has essentially healed. And so those medications are no longer serving the same purpose. And it's too much to get into in this 15 minutes, but basically for anyone who's on chronic opioids, you will become dependent on them at a certain point. And what starts to happen is a paradoxical state within the nervous system where it becomes oversensitized, and it creates, without any fancy terms, more pain. So these folks who are on chronic opioids, they start to realize that their pain is getting more intense, it's spreading and becoming more diffuse, and so they think they need more. And it's a very vicious cycle. So essentially, they cause a lot of really bad side effects. People get addicted very quickly, and it causes more pain. And most of the time, the people that come see us, they're not here because they're helping them live life. They're here because pain is still taking over life, despite the fact that they're on these medications.
We're in a room right now. People might be wondering, hey, I see some exercise equipment behind them. This is where the patients in your chronic pain management program come. This is part of where they spend their day. Let's talk about this program. Who is it right for? Who benefits from it? And what types of activities, or how do you help them, Dr. Siracusano?
Well, to dovetail to your first question, the types of pain that we deal with are literally from head to toe. Persons with headache problems, you name the type of headache syndrome, can be subjected to the same kind of changes in the nervous system that we talked about earlier, and also the same dependency on different medicines to help manage it. Persons with neck pain, middle back pain, chest pains that are not cardiac, abdominal pains, pelvic pains, female pelvic pain, male pelvic pain, lower back pain, leg pain, hand pain, all of these things are addressed. Your question was, who's right for this?
Right.
If you're still having trouble with these things and your quality of life is not what you wish it to be. That statement alone can be a little bit challenging for persons because their life has constricted so much that they just know this little bit of their life now. And we run across this when we ask people, what would you like to be able to do that you're not doing? And they have trouble thinking about it because so much of their life has been given away that they don't even think outside that box. And this gives people an opportunity to start thinking about what could be possible with what they can do with their life, with their families, with their loved one, possibly even returning to work, even though we don't emphasize that, but we're more interested in their functioning, their ability to do things that persons who their age, their body type, their medical status are able to do. The types of things that we do involve a full pain management formula, and that involves everything the nervous system touches, all the way from our thought processes, our emotional processes, but also our physical ones. Exercise affects our emotions affects how our body works, and there is no separation. There's a common mistake that people come here thinking, oh, they're going to figure out if it's all in my head, or if I'm faking it, or I'm making it up. But the fact of the matter is, the nervous system touches everything, and when the nervous system changes, the life changes, and it can be for the good and for the bad. It's very much like the Force in Star Wars. You have the light side of the Force and the dark side of the Force. The nervous system is going to change based on what you do and what you do not do with it.
So the program here is unique. It's a 4-week program. It's an outpatient program. People aren't just coming here and seeing a doctor in an exam room and leaving. Can you kind of explain the structure of the program?
Yes. So a patient has to make the commitment to be here from Monday through Friday, 8 to 4:30 at the latest, for 4 weeks. They go home on the weekends, or if they are from out of town, they will stay in an extended stay hotel, and it's their choice whether they want to stay over the weekend or go home. But while they're here, they're doing a variety of different activities. Their day starts each morning at 8 a.m. with flexibility exercises right here in the gym, led by our physical therapy staff, followed by ice therapy, which I should also say every component of this program, everything we have them do, we educate them about why they are doing it. We give them very specific techniques for how they should be doing that, and what are the risks if they should not continue doing those things after the program. So I think in comparison to traditional outpatient modalities, there is so much more education, so much more hands-on guidance. So exercise is a big component, but it's not a boot camp. They're not exercising all day long. They're not asked to do anything that is not safe for them, and with the intention of retraining their nervous system in a positive direction that will help them to function. They will also be working with individual sessions with their physical therapists for various types of manual therapy. I'll let Dr. Siracusano speak more to that. With the psychologists, we're doing cognitive behavioral therapy, so working on the ways of thinking and behaving that can be affected by pain, but can also exacerbate pain. And we really, our emphasis is to help them learn what is it that is within their control to change. And let's focus on that. Let's accept and learn how to manage the best we can that which we can't change. And following up on what Dr. Sirkisana was saying, I would say that the two biggest goals of our program, when patients ask me, what are you hoping to get out of this? It's to improve you functioning so that you are functioning better physically, emotionally, cognitively in your life than you have been in a while. And then two, to retrain that nervous system. Your nervous system gets, I won't go into, it gets wired up, cranked up. I was trying to use, yes, very, very sensitive. And it gets very cranked up, and we have to teach a person how to calm it. And that is challenging with chronic pain, but it's possible. And so I would say everything we do here can be linked back into those primary goals. Our goal is not to eradicate a patient's pain or even reduce it. That said, the majority of our patients do report a reduction in their overall pain, but that's by way of these other things we're trying to accomplish.
The concept here is really interesting because it's like for this 4 weeks, your job is to feel better. And for people that have been dealing with these types of chronic pains for years, kind of just having that ability to really focus on it for that time period. And it's not something new that you're doing here. How long have you been doing this program?
The pain management, its first name was the Pain Management Center. It was started by a neurosurgeon in 1973, F. Miles Skaltetti, who was essentially tired of doing spine surgeries that didn't get rid of lower back pain or neck pain as well as he or anybody wanted to at the time. And over the years, it has evolved to go along with all of the science we knew at the time. The basic premise has never changed from the standpoint of the pain changes the nervous system is different. We need to help it get back to normal in some way, shape, or form so that a person experiences and works in their life the way that a person, again, appropriate for their age, their body type, and medical status, can do. Despite all the technologies that we have for a chronic pain, if your spouse is still looking at you like, boy, I think you should be doing more than you're doing, or if your best friend is telling you these things, as the old saying goes, if someone tells you you're a horse, you have the right to dismiss it. But if a second person comes along and tells you you're a horse, you have the right to dismiss it. But if a third person comes along and tells you you're a horse, you better turn around and see if you're wearing a saddle. So if you get enough messages, it's usually a prompt to something needs to be changed. And we are about change. You're doing it. What's especially great about this program is that you're not doing it alone. You're doing it with other people struggling with similar or very different things, and it lets you have a perspective as to what it is you're going through, all the way from, well, I'm glad I'm not as bad as that, to, holy mackerel, am I the only one doing this? And they find out that they're not. And that is very, very reassuring to an individual who's been essentially isolated for, you name the number of years that they've been dealing with this. It's either just them and their spouse, just them and their provider, and it feels lost. Team
approaches are huge when it comes to so many things. Dr. Vasek, how is this program different? Will you find anything else like this in the area?
No. The closest would be the Mayo Clinic in Minnesota, and those are the only two in the Midwest. And we have, what's different is what I already explained in terms of the education that is given to each patient at each step along the way. It's also very rare to be working with a physical therapist and a psychologist and a medical staff member who are all working together and on the team together at the same time. So you're going to get that for an entire month here. I would also say that, the thing that I immediately thought of when Dr. Circusano was mentioning the patients that we see is how often we see, and I want to direct this to whoever might be considering this, because I would say that the most common comment I see in the patients who've come through our program, many of whom have resisted doing this at their doctor's recommendation for various reasons. It's a big commitment, but they say, I wish I would have done this sooner. Why didn't I know about this sooner? Life could have been so much different had I done this sooner. So I think the difference is that we don't give you anything that you need to come return to us for. We empower you with the tools and the skills and the knowledge so that leaving here, you don't have to go to another doctor to manage your chronic pain condition. You're your provider.
A shout out and a question that have come in so far, and if you want to continue leaving questions, I'm not sure that we'll get to all of them, but go ahead and we will get back to some of those. First of all, a comment from Stacy, who just says, I'm a graduate of the program and it's life-changing. So Stacy, thank you. And then from Megan, what about people who are currently working during the day? What can you do to help them?
A perfect question. And this is one where a lot of our patients, understandably, if they're working, are dealing with the reality that in order to come here, they need to take FMLA, which may mean reduced or even no pay. And so that is a reality that we know you're dealing with. That said, what I will say is most people do use FMLA and get some support through their work environment that way. And what I usually tell people is that you have to weigh the investment and what you might get out of it. Because yes, up front, you are going to be you'll be sacrificing to be here, but that sacrifice, if it brings your family back a bit of the mom you used to be, or the dad you used to be, or the brother you used to be, the employee, usually that is so worth it. And most of the time, that is the case. I literally have never seen, I haven't been here as long as Dr. Circusano, but in the 5+ years I've been here, I've never seen a patient come through, do everything we've asked them to do, and not be in a much better place at the end of this 4 weeks.
And I do want to go back and touch on the fact again that you do see people that aren't directly from the Omaha area, because you won't find another another program similar to this besides, you mentioned, maybe close to at the Mayo Clinic. So you have seen people from out of state, and that's not an uncommon thing for you. So if they contact you, you can make arrangements.
Right. It would be at no charge to them. We put them in an extended stay hotel that is theirs for the month that they are here. And then if we do have minors at times who have chronic pain, and typically those students, if they are going to school, we'll try and evaluate them and try and place them in a position over the summer where they can be here and won't be missing out on classes.
Dr. Circusano, it's got to be rewarding all these many years seeing all these patients. What's the best part of the job?
Well, the best part of the job is watching a person essentially come in expecting how I've been to a physical therapist before. Yeah. It reminds me of when I was a student, and when I was a student in 1978, I did a clinical rotation in this program. And this older gentleman who had had 7 lumbar surgeries, he told me, I've had 7 lumbar surgeries. I've been to the Mayo Clinic. I've been to all the neurosurgeons in town, across Iowa, even into the Dakotas. I've been to all the chiropractors in town. I've been to all the private practice physical therapists. What are you going to do? And that has been helpful because it makes us all look at things in the unique way that a person with a chronic pain problem is. Meaning, we don't do the same. I would ask Dr. Vosick exactly the same question. So I've been to a psychologist, what you got? And I'll let her answer that question. But as far as we're concerned is, well, first off, we understand what you're going through very well. Number 2, we're going to do it in an environment where other people are learning, and they are your teachers as well, not just us. Number 3, we have experienced people who understand and only do work with persons with chronic pain, which gives them the special expertise and perspective to be walking the walk with the person. Physical therapy, as you can tell, we don't have all the fancy things that you normally see in a physical therapy department, because this is more about brain retraining. It is more about how that interfaces with how we move, how we think, how we stand, how we behave, how we interact, how we sleep, and the list goes on. We even address nutritional issues while a person is here, because the way we eat and our diet plays a role in our chronic pain experience and our mood as well.
And I'm sorry to jump in, but I realized I neglected a lot of things that that a patient will be exposed to in terms of educational topics. We teach a lot about, obviously, pain, acute pain versus chronic pain, the nervous system in the brain, how it works, sleep hygiene, diet, stress management, communication, all sorts of things. They are introduced to Tai Chi and yoga. They do warm water aquatic therapy 3 times a week, which our patients love. So there's exposure to so many types of pain management tools. And so essentially we see people coming in. The best part of my job is not to see people come in, but when I do see people come in desperate, hopeless, feeling like they are at the end of their rope in terms of trying everything, and they still are managing this pain they've told will be there forever. And in 4 weeks, to see the light turn on in them, to see them have belief in themselves, to see them living their life, it is really miraculous. So we see that all the time here in this program.
If I could throw in too, some of this discussion started with me throwing out the whimsical hashtag. Hashtag, if I told you you could manage your pain without opioids, would you do it? That is really the question. Most people on the other side here may be thinking, I couldn't even possibly imagine how to have a life without these medicines to do it for me. But just like Dr. Vosek said earlier, our brains have made those chemicals to begin with, and that's the reason why the medicines work to begin with. The longer we take them, it's like having your spraining your ankle and never taking the splint off. Your muscles never get stronger. Your skin never gets fully vascularized. The feeling in your foot never returns. Yeah. If you keep taking those medicines, it stays exactly the same, but only gets worse over time. The medical carnage of a long-term opioid use is so daunting, but the person is feeling like they have nowhere to go. Hashtag, if I told you you could manage your chronic pain without the opioids, would you?
And we have testimonial videos on our websites for patients who can speak to having been very fearful, thinking that it would not be a possibility for them, and in fact they found out that not only was it a possibility, but they are thriving and in less pain off of those medications.
People taking 30, 40 pills a day in some of those cases, people who've said that their families have them back. And actually we had another story just yesterday from one of your patients who's made it through this program. That's Dr. Jim Herder. If you look down below in this Facebook feed, if you're watching us live now or later, you'll have an opportunity to watch that story and hear from a patient who's actually been through this program. So Amanda, I believe, Amber, we did cover the question about out-of-town people, so if you go back and watch this back over, and also I'll go back in and type the answer to that as well. Anyone who is still adding questions live, we will go back and cover those, so if you're watching this after the live broadcast, don't worry, we know how to get in touch with these two, so we will follow up with them and get answers to all the questions. But first, most importantly, if you or someone you know could benefit from this program, where do you start? I want to go ahead and give you a phone number and the website. NebraskaMed.com is our website. If you search pain management, you'll find some of those patient stories and information on how to get started. And you can always call our call center at 800-922-0000. I'm about to confuse anyone who wasn't watching earlier, but if you're a horse or if you know someone who's a horse, there you go. That's where to get started. I liked that.
I'm going to add one last thing, just
Absolutely.
because I've heard some patients say that when they call that line, it's very difficult to get routed to us. So if our direct number up front is 402-559-4364.
And we'll type that in the comments.
Okay.
Go ahead and
Yes.
say it one more time, but I'll make sure we do that as well.
402-559-4364.
Well, we want to get you the information that you need. Dr. Vosek, Dr. Siracusana, thank you so much for your time. Great information today. You're changing lives, and with so many people involved in the opioid crisis, it is just a fantastic program. And we've enjoyed hearing from all the people involved with it and both of you today.
Well, thank you too.
Thank you for having us.
You bet. And we will see you next Wednesday at noon for our next Moments in Medicine Live. Go ahead and keep posting questions, and we'll see you next week.